On behalf of the co-investigators and co-authors, we were very excited to present the interesting results of the TROPHY-U-01 Cohort 3 phase 2 trial of sacituzumab govitecan, an antibody-drug conjugate against TROP2, linked with SN38, which is a metabolite of irinotecan, combined with pembrolizumab, anti-PD-1, in patients with metastatic urothelial cancer that progressed on platinum-based chemotherapy. So this is second line after platinum-based chemotherapy progression in patients who never received checkpoint inhibitor before. As I mentioned, sacituzumab govitecan is the first-in-class TROP2 antibody-drug conjugates, and it has approval in breast cancer as well as in urothelial cancer, specifically in metastatic urothelial cancer after platinum-based chemotherapy, after checkpoint inhibition as single agent, based on cohort 1 of the TROPHY-U-01 trial that was published in the Journal of Clinical Oncology in 2021 by Dr. Pagawa, myself, and colleagues. So in that study that I'm presenting today to you, this is second-line setting, platinum-refractory disease, immunotherapy naive. Patients receive combination of sacituzumab govitecan, let's call it SG, 10 milligrams per kilogram on days 1 and 8 every 21 days, and pembrolizumab day 1 every 21 days, and treatment continued until progression or unacceptable toxicity. Primary endpoint was objective response rate by investigator review using the RECIST 1.1 criteria. We had total of 41 patients that enrolled and used this dose that I told you, and we want to see at least 13 responses out of 41 patients to reject the null hypothesis of a response rate 20% or less. And in terms of baseline characteristics, we saw that a significant proportion of patients, overall 68%, had visceral metastasis, and approximately 30% had liver metastasis, and patients had received platinum-based chemotherapy, about half of them in the perioperative setting, neoadjuvant or adjuvant, and the other half in first-line setting of metastatic disease. And if we focus the attention in those who received platinum-based chemotherapy for first-line metastatic urothelial cancer, the response rate was only 15%, which is almost 3 times lower compared to what we see with platinum-based chemotherapy. And the median time between the last chemotherapy dose and the screening in this trial was 1.6 months. So the progression after the end of chemo was about a month, which shows how difficult this population is with rapid progressors and kind of platinum refractory, primary platinum refractory patients. Despite these challenging characteristics, the objective response rate was 34% with 1 complete response and 13 partial responses. Additionally, 11 patients had stable disease as best response with a clinical benefit rate of 61%. Median time to response was 2 months, and with a median follow-up of about 6 months, the median duration of response and median overall survival were not reached yet. Median progression-free survival was 5.5 months. Toxicity-wise, we saw what we had expected for each drug by itself. Sacituzumab govitecan can cause neutropenia, anemia, diarrhea, nausea, fatigue, and pembrolizumab can cause, in a proportion of patients, immune-related adverse events. And the combination was feasible. The treatment-related grade 3/4 adverse event rate occurred in 59% of patients, and 39% of patients had reduction in sacituzumab govitecan dose because of treatment-related toxicity. There was no treatment-related death, and 10 out of 41 patients, a quarter, received either topical or oral steroids, and specifically 4 out of 41, 10%, received oral steroids, which is exactly what you expect with Pembro alone. 29% of patients had growth factor, and the percent of febrile neutropenia was 10%, so 4 out of 41. None of those 4 patients had received prior growth factor. So to conclude, in this platinum refractory population, hard to treat population, the combination of SG plus Pembro showed encouraging, promising anti-tumor efficacy with objective response rate 34%, meeting a primary objective, and clinical benefit rate was 61%, median PFS 5.5 months. The combination had a manageable safety profile with no new safety signal and no increase in the immune-related adverse events that needed steroids. The data are not practice changing yet. However, further evaluation of the combination either in platinum refractory setting or even in earlier lines of therapy, for example, the frontline setting. And we have ongoing cohorts, other cohorts in the TROPHY-U-01. We looked at sacituzumab govitecan single agent in the second line setting after progression of first line checkpoint inhibition. And we also look at the cohort 4 and 5, and we combine those cohorts, SG with cisplatin, with or without avelumab as induction, and then maintenance immunotherapy with avelumab plus SG. And these cohorts are ongoing with no data yet. And of course, we have the TROPIC-04 trial. This is in the third line and beyond, after platinum-based chemotherapy, after checkpoint inhibition, and potentially is allowed to have prior enforcement of vedotin if the investigators decide to do so. The TROPIC-04 trial randomizes patients to sacituzumab govitecan single agent versus taxane single agent or vinflumin in Europe. And that's a phase 3 confirmatory trial, tried to validate the results of cohort 1, SG monotherapy in patients after prior platinum-based chemo and after checkpoint inhibition. So we're very excited about the data. Again, we're going to continue the program and development. We're going to look at biomarkers and have a longer follow-up. We're very excited to have presented this data to ASCO GU 2022 and looking forward for further development with this program. Everybody stay safe and thank you for your attention.